I'm talking to Dr. Robert Woollard, who's the Vice Chair of Canadian Doctors for Medicare and who is a professor of family practice at the University of British Columbia in Vancouver. Today he's giving a talk called The Baby and the Bathwater, Evidence on the Challenge of Private Medicine. What's the gist of your talk today, Dr. Woollard?
Well, the gist of the talk is that there's a challenge to Medicare because of the increasing pressure for privatization, which is done under the guise of shortening waiting lists or dealing with some of the issues that we know exist with an imperfect system. And the concern is that we don't throw out the baby with the bathwater, that if in search for solutions to some of the current problems, we don't suddenly break that sort of almost sacred bond between Canadians that's represented by Medicare. And when you start monetizing all of these things, that's when you run into problems.
Where are you seeing the flashpoints in this story?
Well, the flashpoints right now, obviously, are some of the political things with the recent two presidents of the Canadian Medical Association being privateers, if you will, people who have worked outside, are working around the system in a sense, and are now challenging the system to, in a sense, deal away with the Canadian Health Act, which in itself is our best bulwark against this kind of intervention. And then I just want people to understand, and this is a group of people who are dedicated to public advocacy across the whole spectrum
your
of health,
group,
etc. No, I'm talking about the group I'm speaking to today, Public Interest Alberta, and I think this is a wonderful opportunity for us to mutually recognize that although Canadian Doctors for Medicare has, I think, an appropriate focus on Medicare, there are other influences on the public's health related to income inequalities, distribution of services, accessibility to the political process, and so on, that affect people's health as much as or more than doctors do. So I see this as a wonderful opportunity to just have a conversation about what Canadian Doctors for Medicare brings, about what the public advocacy groups bring, and how we can work together.